Adult scoliosis. What are the differences between treatment, symptoms, and possible bracing? Scoliosis is the development of an unnatural sideways curvature in the spine with rotation. This rotation is always into the concavity of the curve. Scoliosis affects all ages. It affects infantile, juvenile, adolescent, adult, even late-stage adult cases. Even though scoliosis is more commonly diagnosed in children, which is the most prevalent type of scoliosis, we actually find more patients to be affected by scoliosis as age increases. So as we see patient populations increase, we tend to see a greater percentage of patients with scoliosis. Now, there are many different types of scoliosis, but the most common type is something called idiopathic scoliosis. And idiopathic scoliosis is when there's not a single cause associated with the scoliosis development, meaning it's considered to be a multifactorial problem, and we can identify any other cause. These are normal, healthy people, but for some reason, they're developing a scoliosis. This is approximately 80% of all cases of scoliosis are considered to be idiopathic. The remaining 20% of cases have known causes, either a neuromuscular scoliosis, a degenerative scoliosis, or a congenital scoliosis. Now, despite the causation or the type of scoliosis, we know all scoliosis is progressive, meaning it is in its very nature to worsen over time. In adult patients, the main type of scoliosis is idiopathic scoliosis. Now, this is either with patients that knew they had scoliosis as a child or as an adolescent, and now they know they have it in the adult form, or either an undiagnosed case in the adolescent form that gets diagnosed in the adult case. And the reason why these cases go undiagnosed in the adolescent stage and now become diagnosed in the adult stage is because of the way curves progress. In children, curves progress because they're growing, and the growing tendency causes these curves to accelerate. Now, sometimes these curves progress, but sometimes they don't. If they go undiagnosed in the adolescent stage, they move into the adult stage. In the adult stage, curves progress as a result of compression of gravity over time. This compressive force is leading to progression is almost always painful. This pain is the number one reason what brings on a diagnosis in the adult form. So therefore, we find a lot of patients that never knew they had scoliosis in the adolescent form have x-rays or an exam performed in the adult form because they're having some kind of pain or discomfort, and then they actually discover they actually have adolescent scoliosis now progressing in the adult form. Now, most idiopathic scoliosis is definitely the most common type of scoliosis that affects adults, but there are other types. And the second most common type is something called degenerative scoliosis. Degenerative scoliosis is caused when the spine has a shift within a certain area, typically the lumbar spine, and this small shift remains uncorrected. And as a result of this small shift, this area goes through an accelerated degeneration. Now, this accelerated degeneration, meaning the spine, the discs, the bones, the tissues, and all the ligaments on the area degenerate faster or age faster than the rest of the spine. And as a result of it, this degeneration is asymmetrical because of the shift that's occurring, and it causes this curve to accelerate. We tend to see this in adults 50 or years and older. It's definitely more common in females than it is in males, and again, it's much more common in the lumbar spine than anywhere else. And what you do is when you take an x-ray, you'll see that this area has gone through an extensive amount of degeneration compared to what's above and below the actual curvature, and we call this degenerative scoliosis. The most common symptom is pain. It's definitely pain in the lower back that can lead to the legs, and typically there's shifting from the torso to the pelvis. There's a lack of alignment. Now, even though adult scoliosis and adolescent scoliosis, the commonality is that there's curvatures in the spine with rotation, these curves are treated slightly differently based upon what we expect and how these curves are to respond. We know in children they're growing, and during this growth, and especially during fast growth, curve can progress in a very rapid phase, meaning we see very rapid progression in this stage. So therefore, we normally want to treat curves quicker, and we want to treat them a little bit more aggressively because we're trying to reduce these curves during growth, trying to prevent the progression from ever occurring. Because we know if we can reduce the curves before the progression occurs, we have a much better outcome than trying to reduce it after they have gone through their growth phase. However, in the adult patient, they've gone through all this growth, and so therefore now they're progressing slower. So we have more time, but I don't want you to think that reducing an adult patient is easier, adult curves are easier, because they become stiffer and normally they become painful. And in this stage, when they become painful, normally pain management is one critical component in the adult treatment, where in adolescent patients typically do not feel pain as a result of their scoliosis progression. So when we understand why the curve is progressing in the adult form, it's because of compression over time. And this slow compression over time causes this snowball progression, where as they get older and the curve gets bigger, the curve tends to progress more. So somewhere around this 40 to 50 years of age, 50 plus, we tend to see this increase of what they're experiencing, what they're feeling, because as the curve is progressing. Now in children, normally the number one symptom that brings on a diagnosis of scoliosis is posture, and it's posture alone. It's uneven shoulders, uneven hips, uneven development of rib arch, where in the adult patient, the main symptom that tends to bring on treatment is typically pain. And this pain normally has to do with the compressive forces. Now, when we look at treatment options, even though the treatments are similar in manners, meaning that we still want to reduce the curve in the adolescent versus the adult patient, and the adult patient would definitely focus more on pain management, on trying to reduce pain and then trying to reduce the curve. Now, the good thing is that normally by reducing the curve for most adult patients, they're noticing an improvement in what they're feeling, an improvement in their pain that they're experiencing, because normally all the symptoms that they're experiencing are directly related to the size of curve, meaning as their curve gets bigger, whatever pain they're feeling, whatever discomfort they're feeling will increase directly related to the curve progression. So as we reduce curves, they tend to improve. Also, a good thing for an adult patient is that we don't have to make curve 0 for them to improve, because there was a point in life that they had a scoliosis that they had no pain. Meaning if you're an adolescent and say you progress to have a 30-degree curve and you had no pain, and they went to the adult form, and as you progress from 30 degrees beyond, you start experiencing discomfort and pain, and then we diagnose you at 40 with a 40-degree curve or a 45-degree curve. Well, normally if you can just reduce your curve closer to 30 degrees where you were when you were an adolescent, when you stopped growing and had no pain, normally a tremendous amount of your symptoms tend to improve, because that is what your body was used to when it grew and developed. So regardless of patient age, we definitely know the best time to treat scoliosis is always as soon as close to the diagnosis of scoliosis, because smaller curves and younger patients will always respond better to bigger curves and older patients. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.